Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome as a guest Svet Milanopulus, who is a public health inspector for Grey Bruce Public Health. And today we're going to be talking about vector-borne diseases. And we've chosen to talk about this topic today because for those of you who happen to be outside in the last couple of days, it's wonderful weather. And we want to give you a heads up about some things to be aware of in relation to vector-borne diseases. Svet, thank you so much for being on the program today.
Thank you for having me.
So you've sent me some amazing questions, which always helps my job as a host. So I'd like to start and ask you the question, what is a vector-borne disease?
A vector-borne disease is a disease that's typically transmitted through insects, such as mosquitoes, ticks, some fleas, but today we're going to concentrate on some of those diseases that we have in our area, such as West Nile virus, which is transmitted through the vector, the mosquito, Culex pipiens and Culex restuans. And we'll also discuss Lyme disease. Lyme disease is becoming more of an issue because of our tick population is growing, and there's concerns associated with both of those diseases because they impact humans. So that is the concern. That is absolutely the concern, and usually the illnesses the symptoms that succumb to both Lyme disease and West Nile are typically the same. That's what complicates diagnosis on the doctor's end of it. Yeah. But if people have been introduced to the virus via the insect, you get fever, muscle aches, headaches, muscle pain, stiff neck, those kind of symptoms that are attributed to it. And in rare situations, it is fatal as well. So that is the significance, yes.
So a couple of questions. So we live in Grey Bruce, and so we're talking about a couple of vector-borne diseases today, but different areas would have different vector-borne diseases then?
Yes, it depends. So for when we're talking mosquito diseases, there's dengue fever, there's malaria, there's a lot of diseases that the vector of a mosquito can transmit, but we don't have those issues because we don't have the species of mosquito that transmit it. Okay. Yes, various geographical areas have different vector-borne illnesses that they're concerned with. And here in Grey Bruce, here in Canada, majority we're dealing with West Nile, then the tick-borne Lyme disease, yes. So there are differences. Even a little bit to elaborate on that yet again, even when we're talking about Lyme disease. The ticks, there's a lot of species of ticks that we have, such as groundhog tick, a dog tick, there's a squirrel tick, there's also a deer or a black-legged tick. And only the black-legged tick out of all those ticks is the vector of Lyme disease. So that is why different areas have different. It's the species of vector that transmit the disease onto the human.
So we're going to go into more detail about each one of those diseases, but basically vector means the insect or bug is the carrier of that disease, correct? And when we are bitten, it can infect us. Where does that insect, how does it become a carrier? And
Very good question. So the West Nile, the cycle for the West Nile virus, the mosquito gets the virus by feeding on an infected bird. So the West Nile virus is in crows, ravens, those larger birds. Blue jays is also one of the culprits that are carriers. And then the mosquito feeds on the bird, picks up the virus, and then once the mosquito feeds on a human, there is our vector-borne disease. That's the transmission. So for West Nile, it's the mosquito gets infected with a bird, and then the mosquito sends it to us. For Lyme disease, the tick gets the disease from a deer, usually. That's the Borrelia bacteria is found on and so the tick feeds on an animal that has the Borrelia bacteria, and then once it feeds on us, it transmits it. But not to be concerned about. There is a time factor for Lyme disease, and the longer that the tick has been attached, the more risk there is for transmission. We'll get into that a little.
Yeah. Well, let's head right into Lyme disease then. So because that's a wonderful segue into it. So maybe you can go through, because you sent me questions, what is it? How do people get it? And also, where are the risk areas? So, I mean, what do I need to be careful about when I'm out and about?
Yes, typically anybody working, living in a wooded area is high, and it doesn't have to be a forest, as long as the vegetation is high enough. So even our backyards, we do have to be cognizant of our wood piles, make sure that the playground structure isn't sitting next to a wooded area. When we're cleaning when we're doing landscaping, we got to be cognizant that these ticks may be there wherever there's a vegetation. But the higher in trails, if you deviate from the path and you go into the forest, then you can the bugs come onto you by simply walking past them, and then they embed themselves. And then if the risk for Lyme disease is significantly higher if the tick was attached and feeding for more than 24 hours. If it has, and again, only the black-legged tick or a deer tick, which is they're the same species. They have two different names, but it's the same species. That is our vector that we're concerned with, and we get a lot of ticks reported from individuals, and so we deal with. There's a lot more of the dog ticks in American groundhog tick compared to black-legged, but that shouldn't be a comfort. You should always check yourself after being in those high-risk areas, such as a wooded area, heavy shrubs with lots of vegetation.
Parents should also check their children, because kids would play, right? I mean, if they're in different sports areas and run to catch a ball or whatever, it would be easy for that to happen for a child who's playing in an area that you've described. So let's say I check myself. I've been out and about and I check myself and I find a tick. Now, I don't know how long that tick has been on me, because sometimes you're not sure, right? They're not like mosquitoes that necessarily you can feel a mosquito bite you, right?
That's correct.
Can you feel a tick bite you?
The ticks can range in sizes. You will feel a tick when it is embedded on your neck. Sometimes under the armpit is another area where they do hide behind your knees, or on your head. Belly button is another another area. Just because people are, like you say, kids will lay around,
Yeah.
and so underarm area wherever it's kind of concealed, and you will feel them.
Okay.
The bite, not necessarily, but when you after, that's why you should check yourself after going into a high risk area, so that because that's your risk right there. So instead of not knowing how long that tick is, when you are introduced in a high risk area, take the time to check yourself, even your pet.
Yeah.
Never mind the kids as well, but even your pet may have a bug on it.
Okay.
So you do have to remain diligent, and if it has been more than 24 hours, we would recommend a physician, a physician to be consulted, because if it's early enough for antibiotic treatment, that's very much the most effective course of action.
So if I find a tick, let's say I find a tick on myself, how do I remove it? Is there a better way to remove the tick? Or because I know I'd be apt to just, besides doing a dance, I'd be wanting to just brush it off. Is there a special way?
There is a special way. The special way is in existence, because when you want to remove the tick, you want to make sure that the mouthpiece doesn't end up still into your body, because that's where the bacteria is. And if you remove the tick, but the mouthpiece still remains, there's still a risk. Because the bacteria is on the mouthpiece of it. So the proper way to remove it is to ensure that you grab tweezers, and you pull directly up, and that way the whole bug comes out. If you don't know what kind of tick you're dealing with, this is called passive surveillance. This is what the health unit does. We do some passive surveillance and active surveillance when it comes to Lyme disease. So if we get a call from an individual saying, "I found this tick. I was working in the backyard. I don't know what it is," you can consult us, and we can give you, if we have a picture. But you can also go to eTick, which is a great website, and you get results right away.
Okay.
So the passive surveillance for the ticks tells us where we're going to go and do our active surveillance, which is called tick dragging. And then we physically go into the forested areas where we know that, an individual has picked it up from here. So that's how we know where to go. And then if we, based on our tick dragging, then there's a risk level for a geographical area, published by Public Health Ontario. So they use our results to inform the public where there's a higher risk of encountering. But don't let that fool you. Because a map is concentrated in one area, it doesn't necessarily mean you're out of the whole risk, because the population is growing, and we are encountering them a lot more in the backyard and in various other locations where we didn't see them predominantly. So don't be, just because one area is identified as a risk, practice preventative controls in anywhere you go that has high forests or wooded areas.
Climate change. Is it making an impact on, you mentioned the population of ticks is growing. Is that because of climate change or other reasons?
It's largely due to our warmer winters and our longer warm weather. The breeding cycle, as long as it's above 4 degrees Celsius, they are able to thrive. So it is as a result of climate change. And it's the breeding cycle. The population increases, and then we have a greater risk because that vector is around.
Before we move on to West Nile virus, just a couple of questions. One is, you mentioned about checking your pet. Is that because pets can get this, or is it because the tick could come on to you unexpectedly?
That's right. The tick could end up on you. Usually, with a vet, you would contact if you find a tick on a pet, you would contact the vet, and usually pets have some treatment for ticks. They can use a preventative treatment so that the ticks don't even go on them. But if they don't have that, it is because you don't want to end up with it.
Yes.
You're definitely right, Carol.
What would you suggest if I said to you, I want to go for a hike and I know that there's going to be tall grasses? Is there specific clothing I should wear, or what should I do to minimize my risk?
You should wear light colored clothing. That is the case for both ticks and West Nile.
Okay.
For mosquitoes, mosquitoes are attracted to the darker clothes.
Really?
So a white long sleeve.
Yeah.
White for the ticks because you will be able to spot them.
Oh.
They're brownish, so that's why it's helpful. Cover the body. You can apply a DEET pest control repellent. That's effective. You can tuck socks over the pants so that they don't get into the skin. You can and then after you can launder the clothing in the dryer. That'll eliminate the altogether. So the less space that you have for the skin to be in contact, the better. So long clothing and bug repellent, even on the clothing if you're in a
That's excellent. I didn't realize about the light colored clothing. That is so helpful. West Nile virus, tell me a bit about that. That's a mosquito, right? Carries that virus?
Yes, ma'am. Mosquito, and we do so much like we do surveillance for ticks, passive and active surveillance. We also do mosquito trapping to see if there's a problem in our Grey Bruce area. Last year, out of all the traps that we have set throughout Grey Bruce, there was no positive pool. And the Lyme disease is a little bit more cumbersome than West Nile to treat, and the symptoms are worse. But for West Nile, about 70 to 80% of the individuals don't even come to any complications. But then if you do, the results are fever, muscle aches, and you have to, for the tick, you would have to avoid contact with the tick itself. That is the preventative measure there, and the chemical ointment. But for West Nile, not only is it protecting yourself with clothing, with chemicals, with netting, but you also have to be cognizant not to allow the mosquitoes to breed. So that's why there's a dual component there. So going back to the monitoring we're doing, I want to report that only 4% of the mosquitoes that we trap for several years, it's around that 4%, are the ones that can transmit West Nile virus. So this is why we monitor, so we can have this data. And that's also why West Nile has become a lower concern because the population we know how to control, but the ticks, we're less in control over that. So it becomes more of a problem. So for the mosquitoes, you want to prevent standing water. You want to prevent whether that's in a tire, in a water bath, in a but any standing water. And the key for the life cycle of the mosquito is 7 days, and that's why dump at least twice a week go in the backyard, see if there's any breeding ground, and dump the water.
Okay.
They need about 6 inches of water and some organic material, and then the larva goes into an adult within that 7 days. So if we can break that cycle, we're lessening the impact.
A very popular thing for people to have in their backyards are bird baths.
Yes, ma'am.
And what you're saying then is be sure to empty that a couple of times a week to break the cycle. You're not saying, people shouldn't have, but you can be vigilant about controlling the environment. Okay.
That's correct.
Yeah.
We have to be responsible with whatever. The answer isn't always eliminate, but we can reduce the impact. And they're beautiful decorative pieces. People love them, and sometimes there's a fountain in a water. So the ripples, it has to be standing water. If the water is moving, it is not gonna be. That's why ponds sometimes have pumps to eliminate the risk, because they really prefer standing water. So there's all sorts of mechanisms and even larviciding that you can apply to eliminate the breeding ground altogether.
Yeah. What you're describing are strategies all of us can do to keep ourselves and others safe, because these are diseases and they can have both short-term and long-term effects, right? So you mentioned that physicians could prescribe antibiotics, but how do they really know if you captured Lyme disease? Are there special tests that they have to do?
There are blood tests that can be done, but the way the doctors traditionally diagnose is through the symptoms. So you get the first reaction that you get from a tick bite is the bullseye rash, which is a telltale sign that you have a symptom. And you should get the proper treatment. And you can be proactive if you know how long that tick has been embedded on you.
Yeah, and the bullseye rash is really, correct me if I'm wrong, but it's like a red circle around that area, correct? Like it's very unique and distinctive.
Yes.
And even if it starts to fade, you would say to people, go and get advice, go to the physician.
Absolutely. Because the longer that you wait, the more the symptoms develop, the longer that the treatment has to be.
Okay.
Absolutely.
Yeah.
Yeah, that's the main factor. The quicker that we respond to it is always the better. And the more that we know about how long the tick, where were you? Because this is going to be a question. This is the passive surveillance. We get that information, and then we go to the hotspot areas to do our tick track. Yes.
So we have about 5 minutes left in the program, and I know that we've been communicating ahead of time, but you had kindly been willing to talk about avian flu and pets, because that is an upcoming issue in our community. And I'm wondering if you can talk a little bit about avian flu. I know here in Owen Sound, we did have concerns because there were some positives in the birds. And maybe you could just fill us in a little bit about avian flu, and then the rest, obviously, to our animals, but also to us.
Right. So the good news about avian flu is the risk to the general public remains absolutely low.
Okay.
And human to human transmission has not established itself, so it's not like the pandemic. It hasn't. Transmission has gone from, so avian flu, there's a lot of birds that succumb to it, and they pass away from it. But recently, we have also seen, not recently, we have seen it for a while, that it has transferred into mammals. mammals such as scavengers, such as hunters, that feed on the infected bird. And they have picked it up. So we have seen it in the past in raccoons. We have seen it in foxes in Canada. We have seen it, and now it's a track. We've seen it in a dog. The first in Canada in a domestic pet, and the way that this domestic, and it happened very recently in Oshawa. And the dog acquired it from feeding on a wild goose that had succumbed to injuries, or it was on the ground and the dog started chewing on it. The virus is spread through the blood and through the mucous membranes of the animal. So to protect your pets, you have to, for dogs, you have to ensure that they are not interacting with the wild birds. You have to make sure that they're on a leash. Cats love to hunt birds as well. You have to be cognizant to protect your pet just like you would protect yourself, because then once we know that it's in mammals, mammals haven't spread it to a human either. There hasn't been a report from a domesticated animal, but animals at a bird market where they have live birds, there is a potential there for humans to pick it up. So humans in the past have picked it up in Africa and in China, majority of the cases. In Canada, we actually had one individual, but they traveled to China, and that's where they picked it up. And it's at these live markets where the live animals are. So the risk to humans is through exposure of the animal. So wherever there's hatcheries, where there's flocks of birds being farms, and backyard chickens also are a common theme now in a lot of municipalities. That you can have a couple of chickens. So we have to. The risk is higher in those areas when we go into feed the birds, when we're defeathering the birds, so you have to be cautious not to come in contact with mucous membranes, or when you're defeathering, aerosolizing their saliva. So those are the risks to humans is not through the animal, not through the domesticated dog or cat.
Yeah.
It's only in one case in Canada. It just happened recently. That's why it's garnering a lot of attention. But the risk to the general public remains low. Evidence suggests that the risks of human contacting avian flu from it is absolutely minor. No domestically acquired human cases of avian influenza have been reported. And so those are the good news that we.
Yeah. So our time.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
Everybody knows not to drink and drive, but some people still think it's okay to take drugs and drive. Police have the authority, the ability, and the tools